I created the elk and the epidural for two purposes. First, I want parents to understand what an epidural in labor often involves, taking into account both the advantages and disadvantages. Second, I want mothers to develop a non-judgmental mindset before labor so that if medical support, including epidurals, becomes necessary, they can stay present emotionally and spiritually for the birth of their child without experiencing feelings of loss or regret. Some parents have asked why I chose to use the elk instead of humans. I thought this message told in whimsical medium would be less threatening to mothers hesitant about the unknown.
When a mother elk prepares to give birth for the first time, she often gathers with friends or in a class to discuss her upcoming birth and the excitement and fears that surround it. Inevitably, she will hear many different opinions about how to manage pain in labor. More and more elk mothers use an epidural in labor, between 70 and 90% in most places. Mothers are not aware of the mindset needed to birth through normal labor pain. Determination and focus are not the predominant images modern elk are exposed to in life or on the television. It's certainly understandable why epidurals have become so popular. There are several types of epidurals. Anesthesiologists experienced in labor epidurals determine which type of epidural is best suited for each individual labor. Short-term epidurals are given toward the end of labor. This epidural can give the mother who's had a long labor a much-needed rest. It can help her relax enough to finish dilating and then wear off to allow her to feel the sensation to push. This epidural is also given just before a cesarean birth. Continuous epidurals provide anesthesia for many hours. The epidural anesthetic is slowly and continually dripped into the epidural space by a machine through a tube inserted in the epidural space just outside the spinal cord. Continuous epidurals are especially helpful during long Pitocin inductions or long labors. Mother elk should know that the walking epidural is not quite what it sounds like. Mothers who have this type of epidural don't really walk in labor. They may be able to move their legs or roll aside, but most hospitals will not allow mothers to get out of bed out of concern for their safety. When labor begins, the elk mother walks in the forest. Accompanied by father elk and their mouse doula, a professional labor companion or a friend experienced in birth, she instinctually knows to walk, move, drink from the stream, and rest to cope with the pain. You can see her baby kicking. Some elk, despite following their instincts, have very long, exhausting labors, or labors that simply will not progress, no matter what they try. Changing position, laboring in warm water, acupuncture, and massage, to name just a few. It's natural for parents to look for a way out. Many wonder how they will know if they should ask for an epidural in labor. It may be compassionate and wise to use an epidural when a mother needs rest after struggling with a long and abnormal labor, during a long Pitocin induction, when she's unprepared or too afraid to cope with the pain, and of course, when a mother gives birth by cesarean. Sometimes, when labor is progressing normally, a mother elk will still ask for drugs or an Father elk and the other birth companions should consider what she may really be asking for is more support, encouragement, and reassurance. If a mother elk has an epidural for any reason, she will labor and birth at Cascade Falls. This is because the safe administration of an epidural requires a cascade of interventions, which are often necessary to keep mother and baby safe from possible side effects of epidurals. Because the drugs used in epidurals relax and open the blood vessels throughout her whole body, the mother elk's blood drop, which could affect the baby's heart rate. To prevent this from happening, the mother will be given a quart or two of fast-dripping IV fluids before the epidural is placed. It takes about 20 minutes for an elk to receive an epidural. The mother elk must sit very still, even through contractions, when the tiny epidural tube is being inserted. Once the tube is in the epidural space, the anesthesiologist will tape the tube to her back so more anesthetic can be given if necessary. 85% of elk with epidurals will experience complete relief from pain. 1 in 10 might experience isolated areas of breakthrough pain, usually out of the body or the other. Only 3% of mothers don't get any relief at all. If an epidural fails to eliminate a mother's labor pain, she can continue to use pain-coping practices she learned prenatally and the support of her loved ones to work through one contraction at a time, while her anesthesiologist works to achieve a more effective epidural. After a mother elk has an epidural, she will not feel the urge to urinate or be able to get out of bed to go to the bathroom. Most of the time, a catheter will be painlessly inserted to empty her bladder for the duration of her labor. One way a mother can view her catheter is to consider the benefits of having an empty bladder. It makes room for the baby to descend. Mothers with epidurals must have continuous electronic fetal monitoring to watch the baby carefully for signs of distress. Some mothers find it reassuring to have a monitor closely guarding her baby's well-being. If the mother likes, the volume can be adjusted so baby's strong heartbeat can be heard by everyone in the room. When the pain of labor fades away, in the absence of mindful awareness, it can sometimes happen that the emotional support mothers giving can fade as well. Father elk and other birth companions who also may be exhausted may feel a need to take a break, and mother elk are sometimes left alone in a room with nothing to do but watch TV or talk on the phone. Some mothers welcome the opportunity to rest or nap, but others may feel disappointed or suddenly lonely. After the epidural, this elk couple stayed focused on being in labor. He enveloped the mother in love and attention while she rested, gently spinning an epidural cocoon around her. They know that it's possible birth from within, no matter what arises in labor. Mother elk and her birth companions can come to realize that even though the pain of labor has ended, the process of birth is still unfolding. She can also remember that her baby elk is still experiencing labor, just as before, and can send her thoughts and love to her little one. About 1 in 4 mothers who receive an opiate or morphine epidural will experience itching. Sometimes the itching will be severe and all over the body. Mother elk can use her coping skills and the support of father and other birth companions to cope with frustrating side effect. Her care providers may offer her antihistamines to stop the itching. Mothers can be very drowsy as a result. Sometimes, when a mother can't feel her contractions, her brain won't get the message to continue releasing oxytocin, the hormone which causes her uterus to contract. Her labor may slow down or even stop. This is especially true if the epidural is given before 5 centimeters. An elk with an epidural is 3 times more likely to be given pitocin, a synthetic oxytocin, to get her labor started again. Occasionally, oxytocin can cause some elk to have contractions that are too long and too strong. These kinds of contractions can cause the baby elk's heart rate to slow down, which can be alarming to both the elk parents and the medical staff. Mother elk will breathe oxygen through a mask and change positions. The pitocin will be turned down or off, and sometimes a cesarean birth will need to take place. A sudden need for a birth by cesarean can be overwhelming. Even if birth attendants are rushing around, mother and father elk can remain connected to one another, their baby, and the birth attendants as the births. For most of the labor, mother and father elk are left alone in their labor room. When the mother is completely dilated and ready to start pushing, the room usually fills up quickly with equipment and many birth attendants who are eager to help mother elk push her baby out. Well-meaning attendants may prop the mother up in an uncomfortable position and then coach her through her pushing contractions by counting loudly from 1 to 10. Some mothers who can't feel contractions because of the epidural find this enthusiastic counting helpful. Fathers may either find it helpful or overwhelming. Father can suggest that mother prefers to push without the counting if she finds it distracting. Birth attendants can help out by wiping her face with a refreshing aromatherapy washcloth, fanning her between contractions, and quietly encouraging mother elk to birth her baby strongly. Because it often eliminates the mother elk's urge to push, her epidural may be allowed to wear off at the end of labor. She can use the sensation of the pain and pressure to direct her pushing, but mothers need to know that the sudden return of labor pain can be overwhelming and another dose of epidural medication may be necessary to cope. Elk who don't know this ahead of time might wonder why they can't push through the pain even though they want to. Receiving another dose of epidural medication may mean the urge to push is lost again, and the mother elk will need to push her baby out without that natural guide. An elk with an epidural experiences no pain, but she also has no sensation of strength in her hips and legs either. She will lie on her back or in a semi-reclined position, which doesn't allow her pelvis to open up as much as it could if she were pushing in an upright position, which uses to help bring the baby down. In some cases, the relief and relaxation from an epidural can help the cervix to open more easily. However, the strong pelvic floor muscles, which guide and rotate the baby's head as it descends through the pelvis in labor, are relaxed after an epidural. Because of this muscle relaxation, the baby doesn't descend and rotate into the best possible position. A mother elk may need the assistance of forceps or a vacuum extractor to birth her baby, which may require an episiotomy as well. Sometimes a cesarean birth may also be necessary. The birth of a baby elk requires hard work, whether technology is a part of that birth or not. Mother and father elk enjoy the moment of birth and greet their newborn baby. There can be side effects from epidural use, even after the birth has taken place. A lingering backache, headache, and shaking immediately after the birth are commonly reported. Mothers who had an epidural in place for 5 to 7 hours may experience a rise in body temperature. This is called epidural fever, which can cause both mother's and her baby's heart rate. When this happens, the newly born baby elk has to go to the nursery for tests and observation. Father elk can usually accompany baby elk to the nursery for these tests. It is commonly believed that epidural anesthetic does not get to the baby. This is simply not true. Substantial amounts of the drugs enter the mother's bloodstream and pass through the placenta into the baby's circulation. The baby's new liver takes several days or weeks to clear the medication from its body. Studies have shown, and many report, subtle changes in behavior of newborns after epidural use. These changes can last 4 to 6 weeks. If a baby is more irritable, withdrawn, and less interested in nursing, a mother may experience confusing feelings of negativity toward her baby and herself as a new mother. Love and support from father elk will be especially important if this happens. If a mother experiences these difficult emotions, she can make a conscious decision to see her baby with new eyes after the effect of the epidural and difficult labor has worn off. She can mark her calendar 4 and 6 weeks after her baby's birth date. When those dates arrive, Mother Elk can create special time to see her baby in a new light. She can give her baby a massage and spend time with other mothers and newborn elk. The use of an epidural in labor carries with it certain disadvantages. It can also provide opportunities that never existed before, such as allowing mothers to take a break from abnormally progressing labors and to be awake and for the birth of a child born by cesarean. When epidurals are used in awareness, mothers can stay connected to their babies, their spirituality, and their passage into motherhood.